Hi guys, um, this is my medical video, but this is only a quick one. I just wanted to let you all know I've had my tests taken at week 4. I'm on declatosphere and sevoflurane, no ribavirin, no interferon because I can't take it. I'll be on this for 6 months. The reason that I'm on 6 months, I will reiterate this, is not everybody's going to get 6 months. It's very, very difficult. And the reason being is because I have such a rare blood disease. No, I'm not a haemophiliac. I have hereditary spherocytosis. My blood eats itself. So this was one of the dangers. And they want to give me the best chance possible of the virus not coming back if I get detected. SVR, undetectable. So my bloods came back. My bloods are the best they've been for probably about 30 years. My red cells are starting to add up, which means my body is not killing itself at the moment, which is a fantastic thing for me, considering my spleen is now not working as it should do. In fact, it's theoretically dead. Hence why they've put me on a low-lying antibiotic now, which I'll have to take for the rest of my life. Now this is going to sound very strange. I went to have my eyebrows done this morning, and it's one of my little treats for myself. And I haven't seen my lady for 3 weeks, and she's lovely. And I went in and she said to me, "Wow, you've lost weight." Now I know to you guys I look the same, and to me I look the same. But she hasn't actually laid eyes on me for 3 weeks. And I don't notice the difference. She did. So it seems, yes, I have more energy, obviously, as most people do when they're on treatment and it's whacking, because it went from 2 million per mil down to, I think the last count was 163, something like that. That was my second week's reading. Now I'm 2 weeks later, so my blood's come back okay. My hemoglobin count is better than it's ever been in my life. My red cell count has gone way nearly normal, which is an absolute miracle for me. Seems as though my blood's behaving itself, all these brilliant points, even though on my medical video 4 I explain in fuller detail why I might not be able to have a transplant. So I'm really hoping this gives me a better quality of life, which it has. I've started to go out once, maybe twice a week. It doesn't sound a lot to a lot of people, but to me, carrying these 2 diseases, in fact I've got 3, if I count another one I have, and a serious mental problem, which I don't talk about with anybody except my doctors. Pretty much I'm as healthy now as I'm probably ever going to be, except if I get if I get a new liver. And I know, Jackie, you're going to say it's not if but when, but I'm afraid my condition's slightly different and I have to be a bit more realistic. So for Jackie's sake it's when, but for my sake it's if, and I'm quite happy with that. I am genuinely, I've wrapped my head around it and I've come to terms with it, and I'm quite happy in that, because I can understand all the reasoning. I'm not stupid and I'm not ignorant. Now, I don't know about anyone else, but when you're on treatment, I don't know how long it takes for you to get your results. They give me my blood results pretty much the next day, but the viral count results take longer. So I've had to wait longer, and I'm at week 4, and I was tested at week 4, which was last week, and I've still got 5 months to go on the treatment, and I'm losing weight, not intentionally, but that's probably because I've got more energy and I'm starting to do more things, so I'm able to burn up what I have, although my appetite has gone south very badly the last few days. And that's not saying I'm not eating, but I've gone back to living on liquids, which could possibly account for it. I don't know. But anyway, it's nice when people do say, oh, you're looking better. And these people genuinely see me at my worst. So that is very nice. And it gives you a kind of boost. Also, I would like to tell you my news. Week 4, I'm SVR, undetectable. So that is fantastic news. Never expected it to have my chances. Most people's chances with this drug, I'm genotype 3, which is the hardest to clear with these drugs. And as I said, no ribavirin, no interferon. Most people with this drug, even with genotype 3, their chances are about 94%. Mine were 53. So Alan and I are so made up. We are just, my family are all happy, all my friends are really happy for me. It's just wonderful. Never thought I'd hear the day after 11 years of waiting for a treatment I can handle. Yeah, just incredible drugs, and good luck to anyone that's on it. But this isn't the end for me, because I do have to take them for 5 more months. So we will see what happens during this 5 months. Is it going to go up again? Is it going to stay down? Really all depends how my blood behaves itself. That is the only thing I can honestly say to you. It's a lovely feeling not being so exhausted all the time. I'm still tired, but that is my other problem. That is not the Hep C tired, but combined with the fibromyalgia, which I do have, and I was diagnosed about 20 years when they first started discovering it, so about 25 years ago, 2020, and I was actually living in Scotland then. So that would be, what is it now, 2015, 10 years back here, 5 years in the States. Yeah, it would be about 20 years ago, 21 years ago. They discovered I had this new thing then, called fibromyalgia. Now it seems like every other person has it, and that's not derogatory to anyone, but it does. They finally realised, yes, it's actually a real disease. And could have told you that. Hurts like hell, knackers you out. Because back then, they used to think we were trying to pull a fast one and get Social Security and what have you, and be, as it was in them days, be on the dole. But we obviously weren't. So I have that. I have my damaged spleen. I still have my blood condition. So I'm still getting tired, but nowhere near the tiredness that I was. It's lovely to be able to go out for a day. We did have a bit of a scare the other day. Alan has not been well. He caught the viral thing that's going around, and he's not been well. And he kept getting pains in his chest, and stubborn old sod that he is, he wouldn't go and see about it because he's my carer and he looks after my mom and all the rest of it. He kept saying, no, I'll be fine. But then his breathing went, and it was so bad, and he said it felt like somebody kicked him in the chest, and then he had pains right through his ribs. So I phoned the doctor. I said, no, this is not on. So I phoned the doctor, and they'd done an ECG at the surgery there and then. Got him straight in. They were excellent. Done an ECG at the surgery there and then. Showed a little blip, so they thought he might have had a mild heart attack or he had angina. He really can't get his breath. I mean, he can walk from sort of 4 yards maybe and he's out of breath, and that's slowly. They done loads of tests at the hospital yesterday. They have done an ECG because theirs was a better machine, came back fine. They done all his bloods, came back fine. They done an x-ray. They think he's got a clot on the lung. He's waiting for a phone call. Has to leave his phone on all weekend, but the doctor thinks it will be on the Monday. The doctor's name was Dr. Bacon, which I thought was quite funny. And he was very good. Our daughter was with him. Charlotte was with him. She's come down to stay. He's quite poorly at the moment. And and he's trying to carry on as normal. And if I'm not around, like when we went to have our eyebrows done this morning, he'd done things he shouldn't have done. So, but then aren't we all like that? But Charlotte's taken a couple of days off work to be with us, which is a great help because I physically can't look after Alan at the moment either. Even though I'm getting better, I seriously can't yet. Which makes me feel like a heel after all he's done for me. But we're hoping upon hope that it's not something very, very serious, obviously. He's really quite poorly. It's quite scary. And I think he realises how we feel now when we get exhausted and can't breathe. But what they're going to do is they're going to give a special x-ray on Monday, you know, where they inject dye and see where it goes and clot. But they could call him in over the weekend. So he's got his phone on all the time and we'll let you guys know, obviously, how he's getting on. So that's a bit of a kicker. And I'll be honest, I think a lot of it is a lot of the stress of living here is not helping. We've had to call the police out twice in the last week for the youngsters upstairs in the room upstairs. As I said, it's like a halfway house and it's a nightmare. And it doesn't help. It just doesn't help us at all. The council will not shift on it. We've got our MPs onto it. We've done everything we could possibly think of, and they just insist, you know, that we're being unreasonable because I won't get rid of my dogs and my birds. And we have an aviary in the garden, such as, well, it's a drying area, but we've turned it into like a patio garden. And I said, no. I said, this government, this country, in one way or another, has stripped everything from me. I said, you're not having what's left. You're just not having it. So, am I cutting my own throat? I don't know. I'm one of these people, I love animals, and I believe, you know, when you have them for life. Whether it be a bird, a goldfish, a dog, a cat, doesn't matter. And to us, they're very, very special. And especially to me, because this disease also took the ability to have children away from me. Which as a female was very, very hard to come to terms with. Trust me on that one. So, yeah, we've had a bit of downs lately, a bit scary moments. But all in all, we're doing pretty good. But I just wanted to tell you guys, yay, 4 weeks, undetectable. How amazing is that? See you guys later. Bye.